Okay, so my name is Tom Larson. I'm going to be playing the part as the trainer or exercise expert in this video. This is my brother-in-law Ethan, and he will be playing the part of the patient who's going to be running through all of these different procedures. So, Ethan, I'm glad you came in today. It's nice to meet you. Today,
Great meeting you.
So what we're going to be doing today is we're just going to be going through a bunch of different tests to essentially determine your overall health and fitness. So some of the tests that we're going to be doing here is we are going to be measuring waist and hip measurements, skin fold measurements, a step test, a sit and reach assessment for flexibility, and a muscular fitness test. So all these things are essentially, we're just going to perform to get an accurate idea of where your body is, and then how we're going to move forward according to what your goals are in the future. So a lot of these tests are super, they're not invasive at all. For the skin folds, all I'm going to do is I'm just going to have to pinch a few different sites all over your body, so it might be a little uncomfortable there just for the pinching.
Good with that.
But for the flexibility test, it's just going to be like we all used to do in PE. Just have to be reaching, kind of sitting down in a V position. We'll go through that a little bit more later on. But you can strain a muscle if you're not careful. And for the muscular fitness test, like I said, it's just a push-up test. Just going to do as many push-ups as you can. And really, realistically, the only kind of caution we want to take there is just let you know that you might be sore a couple days after, depending on your fitness level when you started. So, knowing all of that, do you have any questions or any concerns regarding the testing that we're going to be going over today?
Let's get into it.
All right. So, what are your fitness goals? Are you wanting to, lose weight, gain muscle, or what is it that you're looking to get out of this?
Out of this today, really just want to shred some weight, honestly.
All right, so weight loss is going to be our primary goal. Perfect. So the first test that we're going to do here is going to be our body composition. So the first thing we're going to test is going to be the waist to hip ratio. Okay, so right here I'm just going to measure essentially the thinnest part of your body here in between your xiphoid process and your belly button.
Very thin.
Very thin. All right, that's going to be about right here. So we're going to make sure that this is flat, and then we're just going to see where those overlap. It's about 80.5
Very thin.
centimeters. And then I'm going to have you turn to the side here this way. And I'm just going to measure around this way, mid part of your glute. Okay, about right here where that overlaps. So getting about 99. Okay, I've got to do your waist one more time. Got to make sure that these measurements are within 5 millimeters of each other. Okay. Oh, don't do that. No, you want to keep, just keep your normal. Don't blow your belly out or suck it in. Just do your normal.
Got it, Doc.
Okay. Right there, I'm getting about 80.8. So we're within that 5 millimeter mark. And I got to do one more on the hip, just to make sure that our first measurement was accurate. Go right here. I think it's a little bit. Okay, so we're gonna go here. I think we're done. Right there. You got 89.9, so almost the exact same. Okay, and then we will calculate that ratio after the video, just to check that waist to hip ratio. Now what we're going to do is we are going to do skin folds to try to determine body fat composition. So we're just going to do a simple 3-site skin fold here. We're gonna do specifically of the chest, abdomen, and thigh, all on the right side to ensure accuracy
and consistency.
So the first one is gonna be just midway between the nipple and this axillary crease here. So right here, and then right down the middle, it's gonna be about right there. And then off of the umbilicus or the belly button, we're gonna go right in line, and we're gonna go about 2 centimeters off. Okay, so can you hold that for me there?
I'd love to.
Mark that, bring that down. There we go, now we've got a good sight there. And then for the thigh, I'm gonna have you kick your leg up real quick, just so I can find that inguinal crease here and that proximal part of the patella. Okay, you can put that down. And we're gonna find the midline right in between there. It's gonna end up about right here. Okay, so each of these sites has to end up at least 2 millimeters from each other to ensure accuracy. We're gonna do 2 pinches on each site, 2 skin fold measurements on each site, unless they're not within 2 millimeters of each other, then we're gonna do a third. So the first one here, I'm gonna grab, pinch, pull out. Okay, you can write that down.
Super thin.
All right, the second one, we're gonna go here, the abdomen, 2 centimeters off. Get a good pinch there. Okay, write that down.
That was a very good pinch. Good job, Tom.
All right, and on the thigh here, okay? Right there, good. Good pinch.
Yeah, that was a really good pinch. Wow.
All right, I know, sorry, that's the little bit of uncomfort that you're gonna feel, just not ever fun getting pinched. Okay, we're gonna do now the sides one more time, see if we can stay within 2 millimeters. Okay, we got the exact same there, 19. Go here for the abdomen.
Skinnier this time.
We were right on that cusp, exactly 2 millimeters from the first one. We'll check this thigh. All right, the thigh, we were within that threshold as well. Just to make sure though, on that one that we were 2 centimeters away from, we'll do the abdomen one more time, just to see if I can get a little bit more of an accurate measurement. Okay, that was a little bit better than our second. Okay, and that is how we do those skin folds for the body composition. For this next test, we are going to be doing the 3-minute step test. So here we have our very professional 12-inch step. And so what you're going to be doing here is you're just going to be stepping up, have both feet firmly planted, and down. So up just like this and down for 3 minutes. And I'm going to set the cadence. It's going to be about 96 beats a minute, which is going to equate to about 24 steps every minute, right? So you go 1, 2, 3, 4. So that full routine 24 times in 1 minute, but just go off of the beats of the metronome. So you're going to do that for 3 minutes straight. And then immediately as you finish, I'm going to feel your pulse using your radial artery here, just on your wrist. And I'm going to do that for a full minute. And then what we're going to do is we're going to compare that with your resting heart rate and use that to essentially calculate your approximate VO2 max. Okay?
Got it.
Okay, so I will start the metronome and then I will start the timer. So right now, setting a 3-minute timer, and you can go.
My dudes.
Mm-hmm.
Oh, like a little soldier.
I know, little soldier boy.
Am I done yet?
You are 30 seconds in. Keep going, you can do it.
Thanks, doctor.
You're doing great.
Thanks, doc. Look at that form.
That is great form.
Thank you.
All right, you're about 1 minute down. You got 2 minutes to go.
Time to lock in.
Starting to get warm.
Oh, it's so toasty.
Okay, you're almost halfway done.
Woo!
All right, that's halfway. Only 1:30 left. Okay, almost 1 minute left.
Wow.
Just 1 minute. You can do it. Just one more
I didn't
minute.
think I could ever do this.
Just 1 minute to go. Probably jealous of how good of a workout you're getting.
That too.
All right, less than 30 seconds. You're almost there.
So close. I can almost taste it. The victory of the 3-minute steps.
Eight, 7, 6, 5, 4, 3, 2, 1. Okay.
Fill my artery, hurry.
Stop. Okay. I gotta set a 1 minute timer. We're gonna start now.
Oh, this is awkward. We're not holding hands, I promise.
Okay, so we have a heart rate of 118 beats per minute immediately following our 3-step exercise. And with that number, we'll compare it with the resting heart rate and use that to calculate his approximate VO2 max. This next test that we're going to run through with you, Ethan, is going to be the sit and reach test, which I'm sure you've done before in a PE class when you were younger. So what we're going to do is we're going to use this here, and we are going to space your feet out about 12 inches apart. So I'm going to put this right underneath. Let's bring this foot in a tiny bit, about right there. Space those out about 12 inches, and then we're going to use this tape measure, and this is how we're going to measure your sit and reach. So what we're going to do is we're going to put the 15-inch marker right above this the tape measure that we have laid out, right just by that 6-inch marker, so it's right down the middle. And what I want you to do is you're just essentially going to stretch out, keep like a smooth motion, smooth back, and you're just gonna reach out and touch as far out on this tape measure as you can, okay? And we're gonna do that about 3 times to get your best score, okay? Get your best reach. So just whenever you're ready. Okay, so I got about a 21 on that.
Let's shoot for 25.
All right. You want to go one more time or 2 more times? I did see a 22.
25 up next.
Okay, so we got about right here. Let's see if you can do that again. I saw about 22, and I would have said
A quarter.
22.2,
Oh, dang it.
which is great. And we'll compare that to normative data to see kind of where you fall on the range as well once we kind of total up all of our
Results. And
results here. Yep, at the end. Okay.
Awesome. Thanks, Doc.
Okay, so this next test that I'm gonna have you do, Ethan, is going to be testing your muscular fitness, okay? Specifically of the upper body. So this is gonna be the push-up test, and the simple protocol for this is you're gonna do as many push-ups as you can. So a few just points here is the pivot point is just gonna be your toes, okay? You're gonna want your arms about a shoulder width apart, and we're gonna count the push-up, you come up till your arms are straight. You don't want your stomach or your chest touching the ground at any moment, but you do want your chin to touch the ground, and that's how we'll count, your depth going down and then coming up when your arms are all the way straight. What you're gonna want to do is you're gonna want to exhale with the effort. So when you push up, so if you go down, you're gonna go, chin touches the floor, exhale with the effort. And you're just gonna do as many push-ups as you can, and that's how we're gonna determine muscular fitness. Okay, can you do that?
I can do that, sir.
All right.
Doctor, sir.
And you want to keep your back straight for all of these, for this whole effort.
Time to get after it.
Time to get after it. All right. What do we call that? About 24, 25?
25, sure.
All right, about 25. That's great. So now what we're going to do now with that is we're going to compare that to the normative data and see where you fall on that scale.
Very high.
Okay, Ethan, so just going over your results so we know going forward. First, with your body composition, you had a waist to hip ratio of 0.9, which means you are not at an elevated health risk. For your body fat, we calculated off of those 3 skin fold sites a 19.7% body fat percentage, which is in the 35th percentile. Poor, which is a poor rating, but that's okay because we're going to work on that because your goal, as you said before, was weight management, so we can work towards that. And then for the cardiorespiratory testing, specifically the YMCA 3-minute step test, your 1 minute post-exercise heart rate was 118 beats per minute, which is in the 15th percentile, which is also poor. That's okay, we're gonna keep working on that. For the push-up test, you got 25 push-ups, which puts you in the good category, so we're looking good there.
Let's go.
So yeah, not lacking on the physical strength. And then the flexibility testing is where you really shined. Your best score there was the 22.2 inches, which actually puts you in the 90th percentile rank. So you're doing good. I think just moving forward, we're gonna shred some weight. We're gonna focus on specifically exercises that are gonna help you increase that, I guess, improve your cardiorespiratory function, and just see if we can lower that body fat percentage a little bit. But you're doing great.
Nice. I've been bulking recently, so
We all
understandable.
Have. It's okay. All right. Well, it's been a pleasure working with you, Ethan.
You too, doctor.